hypocrisy we're talking about. They are not back in their building either. So the president, if you really wanted to know what was going on in the country and in corporate America, you'd actually ask Sean Hannity about how they're broadcasting. Hannity's working from home just like the rest of us.
No, that's a very, very good point. Well, the sounds are sweet. Hang in there. Brian Stelter, thank you so much.
I'll make sure the kids are okay. Thanks.
Yeah, all right, sounds good. So the images of thousands of people marching side by side in the street protesting racial injustice fueled a lot of concerns about a potentially dangerous spike in coronavirus infections. But a new study just published by the National Bureau of Economic Research says that so far there actually is no proof any of these demonstrations lead to more cases. Dr. Dave Montgomery is a preventative cardiologist at the Prevent Clinic. Thank you so much for joining us. This is very curious, right? This isn't exactly what we thought would happen. This is a study that measured impact 3 weeks after the protests. Why are we not seeing this spike that seemed almost a guarantee?
Yeah, no, I think you hit it right on the head. There are many in the country, including myself, who expected or are expecting for there to be an increase in the numbers of cases of COVID based on the thousands of people that were gathered in the protests. I will say from this study, important question. I love the attempt and the approach so that we can try to gain some hypotheses generating ideas, but it is not definitive in any way, shape, or form because it's just too soon. As you know, the incubation time, Brianna, of this virus can be 2 weeks. And so, you align that with the idea that what we're actually seeing right now in a place like Texas, Brianna, is that the numbers are increasing precipitously. And that number is made up of a large percentage of people in that demographic, those young people around 30 years old.
So this study also points out, doctor, that social distancing increased during the protests, not by the protesters, but by the people who were trying to avoid them. What could this mean, and why is that noteworthy to you?
Yeah, no, I think it's a really important point, right? We're just discovering everybody's experiencing this for the first time. So what they're saying is, did the effect or the fallout from having all of those thousands of people together for the people who weren't attending those protests and rallies, were those people more careful in doing the things that other countries, for example, have shown us works, right? Quarantining, staying inside, wearing masks. It's still unclear what the impact is. At least their data suggests that there was more people, or were more people, who were quarantining themselves or staying away from large crowds because of the protests.
Yeah, and did maybe they offset what actually happened with the protests? Dr. Dave Montgomery, thank you for joining us from Atlanta.
Thank you, Brianna.